Whilst the Ministry of Health and the Ministry of External Affairs have been on a mission to urge locals to snap up the opportunity to receive free medical services, one group is doing the complete opposite and urging locals to stay away from the initiative. On August 21st, the Ministry of Health issued a statement informing the nation of the imminent arrival of the United States Naval Ship Comfort Humanitarian Mission, USNS. According to the statement, the ship will be providing general services including basic medical evaluation and treatment, preventative medicine, dental screenings and treatments, optometry screenings and eyewear distribution, internal medicine, pediatrics, dermatology, women's health, physical therapy, and provision of medication as needed. But is it all too good to be true? Well, the president of the Ayanola Council for the Advancement of Rastafari, Aaron Alexander, seems to think so.
We should not trust these things. When have America ever wanted anything good for us? After all, remember we were listed as the shithole countries along with the African countries by the president. So I think even in America, they need healthcare themselves. There are over millions of people, they tell you, that have no health insurance, no proper health care, etc., etc. So there's nothing as a free lunch. And when I heard about that announcement, I want to tell my people in St. Lucia, be careful. St. Lucians, be very careful with that kind of thing, because America never went and fight and help Mandela to get out of prison and to fight against apartheid in South Africa. And there's a campaign going on right now to control the population of black people, sterilizing black people, both men and women. So as much as St. Lucians might be tempted, considering the state of healthcare in this country, St. Lucians might be very tempted to go and take advantage of this opportunity. But I'm telling my people to be very careful and be very wary of this kind of thing.
The ICAR president said the U.S. has a dark history of using black people as guinea pigs under the guise of medical services. He said those who forget the past are doomed to repeat it.
I remember the history as far as the Tuskegee experience is concerned, where many of the black men, only black men might I add, were given or injected with syphilis and right to the grave to see how detrimental that disease would have on the black body. And some of them will promise, at some stage within the sickness, they would actually give them some kind of vaccination to stop it, etc. And they never did. So we've been fooled, we've been deceived many times by this kind of disguise of coming under the guise of healthcare and all these kind of things. I remember in South Africa, during the 1980s, under President Botha, there was this nationwide campaign to actually infect pregnant women with HIV/AIDS in sub-Saharan Africa. That is why they tell you that the highest incidences of AIDS and the highest population of AIDS is in sub-Saharan Africa. That is a direct result of the program that was carried out by President Botha through the healthcare system in South Africa, where pregnant women come into clinics, were injected directly with HIV, and they now going home and have sex with their partner, and sometimes their partner have more than one partner, and that's how it's spreading in whole of in the whole of the African continent.
Alexander said if the U.S. genuinely wants to help, there are other ways to do so.
Why can't America then furnish our OKEU hospital for us then? If they have all this latest technology, all this latest equipment, etc., etc., make a donation to OKEU hospital and donate some of this high-tech equipment to us. And at least that would last us longer than the one-time visit. There's the old saying that instead of giving a man a fish every day, teach him how to fish. So bring this equipment to us, make a donation of some of those sophisticated equipment to help our people if you're really genuine about our health concerns in St. Lucia. So my people must be very careful and very wary of this thing, and I definitely will tell you I will not take advantage of this opportunity because I don't trust this thing at all.
All of the ship's services are provided free of charge with no pre-registration necessary for the clinics and are available for all who need care. During its deployment, the USNS will also be visiting other Caribbean territories, including Trinidad and Tobago, Grenada, St. Kitts, Jamaica, Dominican Republic, and Haiti. Reporting for Hot 7 News, I'm Rochelle Gonzalez.